Tonight, join Jane Anderson for a King 5 Children's Health Link special, starting now.
It's do or die for babies in crisis.
Jennifer hugged her and kissed her.
Their last hope is science fiction come true.
We don't want kids to die.
From 3D printed hearts
This is definitely helping.
to babies breathing liquid ventilation.
She's our fighter and miracle.
Witness how doctors are pushing limits and saving lives. Welcome. Tonight we're going to take you behind the scenes of Seattle Children's Hospital and right here at Seattle Children's Research Institute and show you medicine like you've never seen before. We begin tonight with the story of a baby girl born with a broken heart.
A heart, where is your heart? Yeah.
With every beat of that heart, John and Jennifer Campbell count their blessings. It fills their household with happiness and pounds home the fact that their little girl is a medical miracle.
Every risk, Hannah had those risks. I mean,
Every
she
single
was, and so it was very difficult, but we decided, you know what? This was presented to us for a reason.
But certainly not what John and Jen expected back in 2012 when they prepare to welcome Hannah into the world. Jen, already mom to 2 stepsons, follows every guideline imaginable to assure a healthy pregnancy.
For me, this was my first birth, and I just wanted it to be the most perfect thing.
It's anything but. Hannah arrives barely moving, looking sickly blue, her heart racing at 251 beats a minute.
Normal rate's around 125, a little bit less.
What should be the happiest day of their lives turns to terror as Jen and John watch Hannah leave their arms for a trip to Seattle Children's emergency room.
What was the curveball to us in this case was the arrhythmias. We could not control her. We tried all kinds of things.
Keeping Hannah's heart from killing her challenges even the most experienced doctors, including cardiologist Dr. Law, who discovered an additional problem.
It's combination of hypertrophic cardiomyopathy, which is a really, really thick heart, really muscle bound, to the point that it doesn't relax and it cannot fill with blood.
Hannah's condition is so fragile, so life-threatening, the Campbells have to consider a decision no parent should have to make: what to do if their baby becomes brain dead.
We had been through 3 meetings where we said if it gets to this point, we're not going to revive. We will remove life support. And how do you have that conversation where you say, don't revive my kid? You know, when do they become just a piece of meat on the table? And we said, when our child we said to the doctors, if she's not going to have a good life, we will say our goodbyes.
The horror of that decision erupts on a rare night when the Campbells are at home. Usually they could be found at the hospital with Hannah.
And all of a sudden, the pager went off, and I looked at John and I just knew something
That sinking feeling in your gut
was wrong. I just knew it.
Hannah is in cardiac arrest, and the team at Seattle Children's is already performing CPR. When John and Jen arrive, they learn their baby is not responding. Hannah is dying. But there is one last hope: ECPR. It's an emergency procedure that combines CPR and ECMO, a life support machine.
And so really it's for patients who are otherwise going to die.
Dr. Michael McMullen directs the mechanical cardiac support team at Seattle Children's.
We use ECPR to try to establish blood flow to the brain and the rest of the organs to protect the child until the heart can get going again.
But giving ECPR to Hannah requires her parents' consent, and there's no guarantee it will revive their daughter.
But then here we are, faced with this to keep our child alive.
And we had just seen them doing chest compressions on her.
And so when we decided and we signed the papers for ECMO, we thought, this is our last chance.
Because of the relationships we had formed with our doctors and because of the trust we had in the professionals there at Children's Hospital, we said, look, we need your best medical opinion. Is this the path that you would go down if this was your child?
And they told us she had a fighting chance.
And they said she has a fighting chance. She's tough. And we went in and Jennifer hugged her and kissed her and I whispered in her ear, I said, if you have to go, I understand. This was the last stop for her. And this ECPR that they administered gave her the chance to
for her heart
survive
and her lungs
long enough to get on this heart and lung machine and the ECMO.
A hard-fought battle brings Hannah back to life. But to stay alive, she needs a new heart. And finding one to fit an infant triggers another race against the clock.
We knew we were not going to be able to fix things in a sufficient way without transplant. But as you well know, just because you list someone who is desperately needing a transplant, it does not mean a transplant will come up when you want it to. So we waited. We waited.
Weeks extend into months. Then another call comes from Seattle Children's. This time the nurse shares some good news.
But she said, Jen, I think your plans need to change today. And I said, what do you mean? And I said, is everything okay? What's going on? She said, Jen, Hannah's getting her heart today.
It's one of the most joyous moments of your life, but there's also there's a background of sadness there because somebody had to lose their life.
A tragedy in another family gives 4-month-old Hannah a future. With that donor heart beating soundly inside her body, Jen and John witnessed the rebirth of their baby.
Oh my gosh, to see a pink baby, you wouldn't think that it's such an amazing thing, but to look at a child who's so colorless for so long, to see a baby who's pink and glowing, it was like, oh, such a good feeling.
I don't own anything that's pink. It was the first time I was happy to go, you know what? Something that is mine is pink.
Where's your angel? In where? Heaven.
Every day, the Campbells give thanks to Hannah's angel, her donor, whose gift came just in the nick of time. Because during the transplant, doctors discovered Hannah's condition was much worse than they expected.
And it turned out that she had what's called rhabdomyomatosis, an extremely long medical term, but what it means is it's almost like a tumor infiltration.
And it had basically overtaken her whole entire heart organ, and her heart would have continued to grow until it would have killed her.
I've never seen it before, and in fact, it is so rare that it was actually written up as a case report with the permission of the Campbells.
So we're hoping that somehow Hannah's case can help to save some more lives.
Hannah is only the 4th child in the world to ever be diagnosed with this condition, and she is the only known survivor. But that's of no matter to Hannah, who now just likes to laugh and play with her brothers.
Good job.
And the newest member of the Campbell family, little sister Cora.
Cora.
For Jen and John, there is no way to imagine life without all 4 children. They're a happy, healthy family now, celebrating another Christmas together, thanks to a difficult decision that gave Hannah her life.
If we would have never made that choice, I mean, she is amazing. She is strong, and she's funny, and she's brave. There's just so much about her that if we wouldn't have chosen ECMO, we wouldn't have her.
If we didn't have that ECPR that got us to the ECMO, that got us healthy enough to get the transplant, Hannah wouldn't be here. Those 3 steps saved Hannah's life.
Every one of the steps of ECPR has to be done to perfection. It's like a well-choreographed dance, done fast. And when it's showtime, time to save lives, everything has to be perfect. That's why they rehearse. In the neonatal intensive care unit, a sick baby seems to be doing okay until his heart abruptly stops.
Could I have some help in here, please?
What happens next means the difference between life and death.
It's incredibly complex.
It is intense.
It's always do or die.
And that's why at Seattle Children's, they practice to make perfect.
But he's pretty blue.
The baby in crisis is a doll.
It's a very expensive, high-tech doll, but it's just a doll.
And this is only a drill, but it's as real as it can get.
And there's not a lot of time for slowly and methodically making decisions and double-checking things. The pace means that you have to get it right the first time.
Facilitators Dr. Taylor Sawyer and Dr. Joan Roberts work with clinical practice manager Larissa Yellen. Twice a month, Larissa brings together more than 20 nurses, doctors, and surgeons for an eCPR simulation.
All right, we need to turn this baby on the count, Ben.
As we know from Hannah's story, every second counts in this emergency situation.
The reason we're doing this is we don't want kids to die. And with this, we are literally pushing medical care to the very furthest extreme we can. There is nothing else that can be done for that child.
The eCPR simulations at Seattle Children's are the largest in the nation, and they set the standard. For example, the introduction of the metronome.
Can we have a pulse and a rhythm check, please?
It's used to keep rotating nurses on tempo while giving chest compressions in a room full of distractions.
You know, tables moving and vent moving and the patient moving and all of this, they have to stay riveted on, are we doing a perfect resuscitation?
When a baby doesn't respond to CPR, a seamless transition to life support, ECMO, comes next.
Another forceps.
It takes surgery to connect a baby to the heart-lung machine. That's what Dr. McMullen does alongside another surgeon. The operation is called a cannulation.
We make an incision in the neck, and then we have to find these two blood vessels and advance these tubes into the blood vessels. Then we connect them to the ECMO circuit, and we begin ECMO. Bleeding.
Okay, section.
But Dr. McMullen discovered it was hard to recreate this surgery on a plastic mini mannequin, so he and his teammate invented a solution.
So the first thing we had to do is we had to make skin. And so here's some of the skin we made, and you can see it's relatively realistic. And then we went through multiple iterations, and you can see now we use our initial simulator as just the garbage bucket that holds all the earlier versions of the simulators. And here are two examples of the current simulators. Looks like a baby's neck. It acts like a baby's neck.
It is so lifelike, anything can happen to it during a simulation.
Okay, clamp, resume compressions, please.
What's the problem?
And today it does. One of the vessels tears.
The patient had some blood loss. It puts us in a bit of a crisis mode, and it trains the surgeon to begin managing the situation slightly differently.
Adding to the trauma, the man behind the curtain, who can manipulate the baby's vital signs and equipment. At any given moment, he can make bad go to worse.
And then at one point, some air was introduced into the system, and that can happen sometimes. Okay, run the line and make sure it's okay. Can I have some irrigation, please?
And that makes the team have to troubleshoot an additional problem.
It's a bit like the SWAT team. We just have our team practice it over and over again until they got it down.
The practices prove to be paying off. The team is currently working within their record time.
A few years ago, before we had an organized eCPR team, it would take over an hour to put a person on ECMO. And now we're getting it down to 30 minutes or so.
In the world of eCPR, this is the A-Team, setting the pace for other hospitals nationwide.
In fact, when we describe our program to other centers around the country, they're very surprised, and many of them come here to see how we do it. We would hope that if every pediatric hospital had this type of a system, we would save that many more lives around the country. Good job.
And life support played a role in the life of the next baby we're about to meet. But what brought Tatiana back to life shows another way doctors are pushing limits and saving lives. The strength of little Tatiana is best described as Herculean.
Remember how you scared Mommy and Daddy?
She's a pint-sized superhero who overpowered the odds with the help of science fiction-like medicine.
There was concern that she may not survive unless something magical worked for her.
Right from birth, Tatiana struggles. She's sickened in the womb, causing her mom, Elise, to have an emergency C-section.
They said it looked like she had pooped inside of me and swallowed some of it. So we had a C-section. They brought her out, and I mean, I'm still like, 'cause I had a C-section, so I was still laying on the table, and I just seen them kind of rushing her off.
Tatiana's destination is Seattle Children's, where doctors immediately treat her life-threatening condition known as meconium aspiration.
And so the lung gets diseased and damaged very easily. And Tatiana had one of the most severe cases of meconium aspiration with pulmonary hypertension that I have ever seen.
X-rays reveal the cause of concern for doctors Kendra Smith and Craig Jackson.
But at this point, we had no air going in and out of her lungs at all.
Normally lungs are this color, a dark, because they're air-filled. Her lungs were so diseased that they were white.
Unable to breathe, Tatiana is placed on ECMO, but it's a short-term solution. Staying on life support for an extended amount of time can damage a baby's brain.
And so when 2 weeks went by, we knew we were in trouble. She wasn't getting better. We were trying all things we could think of. And by 3 weeks, we knew we were at the end of the road.
At this point, doctors know they must take a detour into new territory. Driving that decision is Tatiana.
When she was on extracorporeal life support, she would open her eyes and look at you and indirectly ask you if there wasn't something out there that could make a difference for her.
Dr. Smith does have a long-shot idea, a drug she researched years ago, not yet approved by the FDA, perfluorocarbon. It's also known as liquid ventilation.
Okay, let's rock and roll.
And very science fiction-like.
Okay, relax now, bud. Just relax.
So it's very much like in the movie Abyss, where the guy dons on the headgear and fills up with perfluorocarbon and tries to breathe it.
In the real world, it works a bit differently, as Dr. Smith demonstrates.
So perfluorocarbon is a clear, colorless liquid. It dissolves a large amount of oxygen and carbon dioxide. In this circumstance, with diseased lungs, we're using it actually to open up the lungs so that they can work better and work better sooner.
It sounds promising, but it's not a slam dunk for Tatiana.
And so we didn't try it until she was at the point where virtually all of us thought she was going to die.
Being the only option for your daughter to survive, there was just no question about it that, yeah, we wanted to try it.
At that juncture, we elected as a team to try to seek out FDA approval for using perfluorocarbon in her lungs.
Dr. Smith submits a compassionate use request to the FDA. She hopes to be able to use the experimental drug for just 10 days.
I wanted them to give me 10 days because I felt within 10 days that we could turn her around.
Her request is granted. Doctors begin injecting the dense liquid into Tatiana's lungs. Within 5 days, she responds to the life-giving drug.
That's when she miraculously got much better. And the fluorocarbon has now become a thin film all over the lung. And that's great because that thin film of fluorocarbon holds oxygen and gets rid of carbon dioxide very efficiently.
As Tatiana's lungs continue to heal,
so she's breathing on her own,
the liquid ventilation is allowed to evaporate.
So that's why this is exactly what we wanted to see her lungs look like.
In Tatiana's case, she was not expected to survive, and I think this medication made all the difference in her life.
Who is that?
Who is
Hey.
that? She looks great, Elise.
Yeah,
she looks great.
Seeing Tatiana now, there's a sigh of relief. She's a bundle of joy and determination.
She's our fighter and miracle. I see her growing up to be a healthy girl. She's putting on weight good now. She's gonna be tall like her dad, but yeah, she's already active as of now, so I know she has a purpose. Yeah, she came back, she has a purpose, and we'll see what it is. Yeah.
Tatiana is already having a major impact on medicine, and doctors hope to be able to make that same drug available to other patients in Tatiana's situation. So, if liquid ventilation isn't mind-boggling enough for you, how about a 3D heart printed on a copier much like you might have at your office? Only this one is so high-tech, it's changing the face of medicine. And doctors hope it will change the life of a patient well known at Seattle Children's.
Hi, I'm from the American Heart Association.
Our relationship with Cammie Sutton goes way back.
I was wondering if you'd like to sponsor me.
Through the years, we watch her improve the lives of others.
Well, I'm riding in my wheelchair and my mom is pushing me.
Even though her own health is weakened by a severely damaged heart.
And I'm waiting for a heart transplant.
7 years and numerous surgeries later, we share in Cammie's excitement at an endurance race in Daytona Beach, Florida.
This is our spirit driver right here.
Cammie is the inspiration behind Team Seattle, a children's hospital guild raising money for a world-class cardiac care unit.
I was transferred to Children's by ambulance at 4 hours old, where they discovered that I had a severe heart condition. I had my first surgery at 12 hours old and my second at 36 hours old. I started my life at Children's Hospital. They saved my life.
Another 7 years pass, and today we catch up with the 26-year-old at the American Heart Association, where she now works as an advocacy coordinator. Cammie still waits for that transplant.
I'm healthy enough that there are patients more critical that need these transplants ahead of me. Right now I'm on a record of how long it's been since I've had a procedure, and it's going a little over 5 years now. The past 5 years have allowed technology to advance that it's looking like I might not need that transplant in the future. So that's really promising and looking like that it might not happen, and I've known I needed a transplant since I was 7 years old.
What could be the answer for Cammie and eliminate her need for a new heart is a high-tech 3D printer. No single sheet or two-sided copies here. Instead, what's printed by this machine has dimension, texture, and the ability to reshape medical care.
I have not heard of anybody doing it other than us.
Dr. Tom Burke is in the unique business of printing hearts, human hearts, exact replicas of those found in patients.
Patient-specific heart that you could practice a surgery on.
Data gathered from MRIs and CT scans feeds into the printer.
And you can think of it as a sponge, a detailed sponge in the shape of that person's heart.
What Dr. Burke does next is top secret. He's figured out how to make the printed hearts feel soft and squishy like the real thing, instead of stiff and rubbery.
But the heart itself is flexible, and we have to then marry hard and soft materials.
Hot off the press is that duplicate sitting in the Ziploc container.
And in fact, this heart is pretty distinct.
It's a copy of Cammie's heart.
Oh, cool. Yeah.
A duplicate was printed up and given to surgeons Steve Sessler and Kristen Patton.
So, Chris, I can't make this turn with this wire.
Sometime in the near future, they'll be operating on Cammie. So getting a good look at her heart now,
there we go,
and being able to practice on it,
there, okay,
is extraordinary.
Once you're in the coronary sinus, the question is,
can you get here?
Can we just sort of get out to there?
The plan for Cammie is to give her a second pacemaker that will help synchronize her heartbeats.
What Cammie needs is a different way to have her heart paced.
Because right now I'm only having, the pacemaker lead is only going to the right side, and the left side's beating later. So we're losing some heart function because of that. So it's looking like if they do this new pacemaker and it works, I could have better heart function and better quality of life.
We thought that this technology might allow it to be possible.
But here's the problem. Cammie's anatomy is so mixed up, it's hard for Dr. Sessler and Dr. Patton to find the right path for the pacemaker's lead wire.
And so we're in a position where we have to be creative. There are two acute angles here that we're going to have to overcome.
It provides such a nice level of extra safety to be able to practice without the patient.
At this point, it's looking to me like the left side might be a better option. Again, this is doing exactly what we wanted to do. It's showing us where our problem spots are.
It's the first of many practice sessions. And if the surgeons need another heart, they can print another one.
This won't be the one and only time that we do it. You know, we've already learned a couple of important things from the model, and we've really just started.
While the surgeons practice, Cammie and her family anticipate a successful surgery and new opportunities in the years to come.
Go out and do even more, maybe travel if I can be able to come off the heart transplant list, I can travel again, and I'm really into auto racing because of my experiences with Team Seattle and Sovereign. So getting to more races and seeing friends that I don't see very often, just adventures, fun adventures.
We'll keep you posted on Cammie's progress, and we'll let you know when her surgery is scheduled. Now, we'll give you a peek into the future, when children who are born with inherited blood diseases can make one stop at the doctor's office and be cured. That's the hope of this breakthrough research being done right down the hall here at the offices of Dr. David Rawlings and Andy Scherenberg.
And for me, you're more likely to get a consistent result in that case.
What Dr. Scherenberg does at work is monumental.
Every day I come in energized.
After all, he's trying to cure kids who were born with inherited diseases.
You have to remember, these are kids who, from the minute they were born, have a disease which effectively there hasn't been a treatment for.
But Dr. Scherenberg and his team plan to change that with one trip to the doctor's office.
And then ideally that then is the last thing they need to do.
The science gets complicated, but basically it involves repairing and replacing defective genes in our bodies.
That is, the genes are kind of the blueprint for every cell in your body, and there's a copy of those blueprints in every cell in your body. And if there's a mistake in those blueprints, your cell does not function properly if there's a mistake in the design. So we have two options. One is to put something in that can maybe reinforce that mistake, so that's what we call gene replacement therapy. The other possibility, which is much more elegant and the one I think we prefer, is to fix that blueprint, make it perfect again, and that's the gene repair.
Right now, the team at the Research Institute is targeting inherited blood diseases like sickle cell anemia.
It's already pretty good, yeah.
And they're about to take their gene replacement therapy out of the lab and into clinical trials.
We're at the very beginning stages of practicing it, but when you take things into a patient, you have to be able to do it perfectly every time, so we're moving along that path of refinement.
It will take more hard work, but Dr. Scherenberg says what once seemed like science fiction is now becoming reality.
At least from the way I think about it now, on the horizon as opposed to being science fiction.
Tonight we've seen how doctors, researchers, in fact the whole team here at Seattle Children's is pushing limits and saving lives. If you'd like to find out more about this effort, you can log on to our website, king5.com. And as always, we want to thank the families and the doctors for letting us into their lives to help share their stories. And we'd especially like to thank you for joining us tonight. I'm Jean Anderson, King 5 Health Link, linking you to better health.